pills to pass still. The phone is ringing, lights are going off. It's time for breakfast or dinner, whatever. It's a meal, right? So you're overwhelmed. So you walk in a resident's room in a nursing home who is a hospice patient and they're on the floor. What do you need to do? All right, I would say the first thing you need to do is breathe, because I know you got pills to pass still. The phone is ringing, lights are going off. It's time for breakfast or dinner, whatever. It's a meal, right? So you're overwhelmed. So I would just say breathe, right? And then the next thing to do is assess the patient, or if you are not uh, the registered nurse, charge nurse, or I would say call the proper party to assess before that patient is moved. Um, and then next, right, you assess, you guys got some vital signs, they're safe. You've got them in a comfortable position, whether that's back in bed, if they're safe to do that, and you go pick up the phone and you call hospice, right? Especially if there's a concern. If you have a concern, you should notify hospice right away. Okay. Why do I say this? I say this because there are instances where patients who are on hospice are sent to the hospital, because there is protocol in some facilities for um, a person to be transferred to the hospital if they hit their head. Okay. But with a hospice patient, you need to be collaborating with your hospice team, because the situation is going to be different. We don't want those patients in the hospital unless they absolutely need to be. When they go, their labs are drawn, they're treated for all kinds of things that are not necessary most often, right? Say the person, it looks like they've hurt themselves, maybe they've fractured a bone, a hip, or something. And you're still going to assess, do your vital signs, and you're going to notify hospice, because again, there's going to need to be conversations between you, hospice, the patient, or the decision maker, with what does it look like? What can we do, right? What can we do in place? Or do we want to send them to the hospital and they may need to have surgery, etc. But to say all that, if you have a patient on the floor, they're a hospice patient, again, you do the same steps of assessing, but the biggest thing is notifying hospice so that you guys are working as a team to figure out what's next for that patient.